and welcome to Sagepoint Update. I'm Joyce Riggs. I'm here today with our special guest, Joe Bianculli. He's an attorney with Healthcare Lawyers, and Joe is here today to walk us through the very, very complicated process, regulatory process for nursing homes in the state of Maryland and federally, and in particular, this last year and a half because of COVID, how this has affected Sagepoint. So Joe, thank you for coming. Welcome.
Pleasure to be here.
So can you talk a little bit about how the allegation that Sagepoint did not cohort or separate the infected with the non-infected residents?
Well, you know, Andrea was very concerned during the survey about the kind of training and background that the surveyors had. We found out during the appeal that the state did not have training materials on COVID collected and available to the surveyors yet. So one of the surveyors had downloaded the night before the survey some materials from the CDC website, and the other really had just looked at some CMS training videos on how to do surveys, but nothing specific. And what we found was that they kind of confused a lot of the principles that were even in some of the traditional CDC guidance. So I mentioned a few minutes ago that the CDC, their principal tool that they make available to healthcare facilities is isolation, right? If you've got a lot of people living under the same roof, you want to separate the ones that are infected from the ones that aren't, the theory being that that's going to reduce the chances of spreading the infection. And there are various ways the CDC says you can do that. One is to isolate infected people, typically in a single occupancy room with a bathroom that's not shared. Then the staff going in and out of that room will wear appropriate PPE. They'll be gowned, they'll be masked, they'll have eye protection, and so forth. In the case of COVID, we learned pretty quickly that it was spread by respiratory droplets, right? And CDC said pretty early on that the principal way it spread was from respiratory droplets directly from what they call the mucosal surfaces of an infected person, their mouth, their nose, their eyes, to the mucosal surfaces of a non-infected person. So I sneeze or cough on you, you can get the disease in your nose, in your eyes, in your mouth. So caregivers have to protect themselves by wearing gowns, masks, eye protection, and so forth. But that also protects them from spreading it if they change their PPE and so forth. Right, so the CDC said put infected people either in a single occupancy room or cohort them. That is, create an area of your facility where people with similar infections, so they can't give it to one another, will be isolated. Or if all else fails, separate infected and non-infected people by at least 6 feet. The belief being at the time that the respiratory droplets, from my mouth could not go more than 6 feet, right? And some science supports that. Well, when the surveyors came in, right, they saw that Sagepoint, as soon as it had received its the first round of test results, had started cohorting residents. They set up certain units as COVID positive, certain units as COVID negative, and had certain units as under investigation. And that would be people that had been tested and they didn't have the results back yet, or somebody who had been exposed to somebody with COVID but it wasn't developing symptoms or whatever. And literally within a day of getting test results back, Sagepoint moved like 70 people around the building. And there were a number of residents who were already in single occupancy rooms who ultimately tested positive. Several of them tested negative originally, then tested positive. And those single occupancy rooms were located in otherwise COVID negative areas of the facility. And so the surveyors misunderstood, and the ALJ found that they misunderstood the CDC guidance. They cited the facility for failure to move those residents that were in single occupancy rooms. They said that they should have been cohorted to areas that were COVID positive. we said, wait a minute, you're misinterpreting the CDC guidance. The CDC says isolation by way of single occupancy room or cohorting or distance, right? Because these people, these residents already were in single occupancy rooms, they were a very low priority to be moved. All of them ultimately were moved after several days. But when the surveyors were there, they said, no, cohorting trumps isolation. The ALJ said, no, they've got that backwards. Isolation is the goal, and cohorting is the method of doing it. So that was one big set of allegations that turned out not to be correct. Right?
And the ALJ is the administrative law judge who heard the
That's correct.
The case. Okay.
That's correct.
The allegation, can you discuss the allegation that Sagepoint did not have an effective or a tracking system for COVID testing?
Right. Go back and look at the chronology a little bit. All right. So at the end of March, a resident who was in the hospital for unrelated reasons tested positive for COVID in the hospital. So that's when Andrea went to the county, asked the county again for more assistance in testing. The county said, we don't have the ability to do that, but we will make introductions to people at the state and see if the state lab can do that. Right? They did that. The state lab said, well, we can do some, but not all. Sagepoint scrambled around, ultimately found a lab that could do the rest. Right? The usual lab that the facility would use couldn't do it. So Sagepoint wound up using a different lab that it hadn't used before and tests from the state. And I think you ran up and actually picked up the tests from the state. Right. So the tests were done first week of April, and the test results started coming back a few days later. Well, the lab that Sagepoint hadn't used before set up a different system for reporting results. Ordinarily, when a doctor orders a lab test for a nursing home resident, right, the lab picks up the sample. They then will either fax or call with the result. The nurse gets the call, gets the fax, talks to the doctor, gets the order for the medication, whatever it is. And that's a system that's been in use for a long time at Sagepoint and every other facility. The state has no problems with that. This lab set up a web portal to retrieve the results. And somehow or other, they forgot to post the result for a single resident. They posted all the others that they had done. That resident's family called asking about results. We followed up, got the result. Turns out the resident was positive, right? As it happens, that resident had been isolated in a single occupancy room the entire time. So she had not even been exposed to other residents. And so there was no chance that she could infect other residents. But the surveyors somehow misunderstood how that new lab was posting its results, and they thought that we were keeping a list of lab tests and results, and somehow or other it was our fault that we had missed this. What the administrative law judge said was, first of all, they had misunderstood or some conversation. They had misunderstood a staff person at Sagepoint to say we had no system or we had no way of tracking results, which was not true. They then confused the usual system for lab test results with the way this new lab was reporting lab test results. And then finally, they didn't know or didn't appreciate the significance of the fact that the resident had been in isolation the entire time. Because the resident never exhibited symptoms, this resident never was symptomatic, she never got sick, she wouldn't have been tested at all under the state's guidelines.
Because there were no symptoms.
And so we had gone above and beyond. And so we actually had our expert, an infectious disease physician from Johns Hopkins, basically saying, had the facility done what the state told them to do, they wouldn't have even known what this resident's status was. She would have never been tested at all. But because they did test her anyway, they found out she was positive, but in the meanwhile had kept her isolated to protect other residents. And the administrative law judge said, that's exactly right, right? She never would have been tested at all under the state's guidelines, so presumably the state would not have cited a deficiency at all had she not been tested at all, right? And the facility did the exact right thing by isolating her. And, by the time the test results came back, it was academic because she wouldn't have been contagious at that point anyway.
She was outside of the window of
Right. The number of days has changed. The CDC and other guidelines have changed over the years. But basically, the rule of thumb is if you go 7 to 10 days after getting a test that's positive, but you never exhibit symptoms, or 7 to 10 days after your symptoms are gone, you're not contagious anymore. So this resident never exposed anybody, and the judge said there was never any danger to anybody.
Next, can you talk some about the allegations regarding PPE in the facility?
We're seeing this in every single COVID survey. And that is, a surveyor will see a staff person whose mask is pulled down over their nose, or they think they're taking their gown off improperly, or they're walking in the hallway from one room to the next, or they're not washing their hands properly, or they haven't taken their gloves off properly. And our experts tell us that those sorts of minor inconsistencies almost never pose any risk. In this case, the surveyors wrote up a whole bunch of things that didn't even violate CDC guidance. And just to give you some examples, and again, the ALJ, the Administrative Law Judge, found that every single example that they wrote up was not correct. But some examples are the day before the survey, a federal strike team, a bunch of consultants, physicians, nurses, epidemiologists, and so forth, had visited Sagepoint, and they indicated to the staff that for non-direct patient care activities, it was okay to sanitize gloves rather than changing them every time you touch something, because as you know, at that time, there was a tremendous disruption of the supply chain, and PPE was in short supply, and facilities didn't know where their next shipment of gloves and gowns and so forth was coming from. And so this physician from the Public Health Service told the staff, you can sanitize your gloves using alcohol sanitizer for non-patient care activities. For example, you touch a keyboard, or you touch a doorknob, or you touch a railing, or something like that. Surveyors came in, and they thought that was an infection control violation, so they wrote it up. Even though we told them that the CDC said it was okay, and we had the written guidance, and that the Public Health Service said it was okay. And as a matter of fact, we found out later the Maryland National Guard was going into facilities and saying it was okay as well. At the hearing, they weren't really able to explain why they thought it was an infection control violation, and so the judge set that aside. They originally cited crazy things, like a nurse dropped a hand-sized, personal bottle of hand sanitizer on the floor and picked it up, put it back in her pocket. And they cited that as an infection control violation. Well, we knew then, and we know now, that COVID is not spread by touching things. It's spread, as I said, by droplets. So that was not a violation. They cited staff for not gowning up before they went into the COVID positive unit, where we know the CDC has given guidance, for example, that there are various ways to do it. They cited a nursing assistant for taking her gown off, rolling it up properly, where you roll the inside out, but holding it against her clothing as she went to put it into a bin. And again, the inside was already touching her clothing, so the judge correctly found that wasn't a violation. And then they cited other crazy things like, that there weren't disposal bins, doffing stations, they called them, located on the units, where we showed, yes, there were. There was one in every room. So the hearing wound up going off for hours and hours on to discussion of the appropriate use of PPE. And as the ALJ found, the surveyors are basically taking one idea from this document, another idea from this document, and another idea from this document, but never really putting together what the CDC guidance about use of PPE was. And part of the complication was that guidance changed rapidly during the spring because of the shortages of PPE. And people can remember hearing stories of, nursing facilities running out and buying, ponchos at the dollar store because they ran out of gowns and that sort of thing. So the CDC throughout the spring was putting out lots of guidance about how to conserve PPE, what substitutes can be used for PPE, what old PPE rules could be, modified. I mean, for example, before COVID, it would be considered a significant infection control violation to wear PPE in a hallway, in a non-infected area, right? Well, the CDC was saying, look, there's not enough gowns to go around to change it every time you go in and out of a room, so it's okay to reuse gowns so long as they're not soiled. Things like that. And unfortunately, the health department here was just not up to speed on that kind of guidance.
And it's a very complicated story, but you did a wonderful job in breaking it down for everyone. So thank you very much for coming, Joe. We appreciate it.
Thank you. Always a pleasure.
Thank you for joining us again, and we'll look forward to talking to you with our next update.